The constant drumbeat of coronavirus stories everywhere that you turn can create anxiety and trick you into believing that social media posts about ways to avoid the virus are true. And some, like this myth, can be dangerously misleading. Holding your breath can tell you if you have COVID-19. Now, that advice is part of a so-called self-checklist that is circulating in various forms, claiming you can check your lungs for the virus by holding your breath for 10 seconds. So, let's see what that accomplishes. I'm going to hold my breath. Okay, the myth claims if you can do that without coughing or discomfort, it shows your lungs aren't scarred by fibrosis, meaning you aren't infected. Wrong! The only way to show if you're infected with COVID-19 is for doctors to use a test kit like this. Breath holding is no test for infections or anything else. It's medically unsound and gives you a false sense of security. And here's another myth that falls under the category of medically unsound. The myth is social distancing doesn't apply to the young and healthy. Despite the warnings from the government and health officials about avoiding large groups, many people in their 20s and 30s are ignoring the warnings, like these kids on spring break. Though the young are less likely to die from COVID-19, everybody is a potential source of infection, and an infected young person can easily transmit the virus to more vulnerable individuals. So no matter what your age, back off. Keep yourself 6 feet away so you won't put somebody 6 feet under. Working for you to keep the myths at bay, I'm consumer investigator Steve Sprazier. Some myths get people's attention because they go against the grain of accepted science and advice, such as the case of this one particular myth which tries to get you to stop doing something which will help keep you from getting infected. Here's the myth. You should not rely on hand sanitizer to kill the COVID-19 virus because it really doesn't work. Now, since this pandemic began, medical officials have been saying, wash your hands with soap and water. If that's not possible, use hand sanitizer with an alcohol content of 60% or more. But this viral post surged its way across Facebook offering contrary advice. Claiming to be from a scientist tired of this, it says hand sanitizer is antibacterial and COVID-19 is a virus and thus it won't work. Well, the post correctly claims that a virus is not a bacteria. But the real science behind how hand sanitizer works on a virus is this. These blue dots represent the alcohol molecules in hand sanitizer. This gray ring represents the fatty protective layer around the virus. The alcohol molecules attached to the protective fatty layer reacting with the fat, literally dissolving it, that leaves the virus unprotected. Once that happens, the virus falls apart and is no longer an infection danger. By the way, soap works the same way on the virus, demolishing its ability to protect itself. That's why the CDC is among healthcare agencies recommending hand sanitizer as a secondary way to rid yourself of the virus. And remember, hand sanitizer and soap only keep your hands germ-free for so long, so after you touch potentially infected surfaces, you've got to re-cleanse. So that's just one myth you can wash your hands of. Working for you, I'm consumer investigator Steve Sprazier. Sometimes myths come back again and again, swaddled in new wrapping paper like a badly regifted item. Such is the case about one myth regarding face coverings, which has been brewing for a while now. Here's the myth that you can use a coffee filter as an effective mask to keep the COVID-19 at bay. This myth got wide play the other night on Stephen Colbert's A Late Show at Home when guest Matthew McConaughey demonstrated his homemade face coverings.
Here's how. So you lay down your favorite bandana, unfold it like so. Get your trusty coffee filter that you had on the go. Get your 2 rubber bands. Roll one down one end like this. Roll the other one down this end like that. Fold them over like so. Grab a hold, and you're good to go.
After that segment aired, I was contacted by a clinical researcher who specializes in viruses who was aghast that coffee filters would be suggested as a material for face coverings. Now, previously, we warned you against using paper towels as a homemade face covering because they don't effectively block the virus. The researchers said that coffee filters, like all paper products, attract moisture, and that's dangerous because you want to avoid anything that grabs or absorbs a liquid. The CDC says that homemade face coverings are supposed to help stop virus-filled droplets from reaching you. But a coffee filter or other paper product will absorb moisture, bringing those droplets closer to your mouth, defeating the purpose of the face covering. Now, Melita, a coffee filter company, warns on its website against using coffee filters, saying the coronavirus is smaller than the pores in its filters and they do not provide the protection required. The CDC and others say that several layers of cloth folded upon itself are the most effective makeshift face covering, but they should only be used once, then washed in hot soapy water to remove any contamination before using again. So, though this coffee filter myth has been percolating on the internet for a while, you need to get rid of it the same way you would with used coffee grounds. Working for you, I'm consumer investigator Steve Sprazier. When it comes to myths, people love to cite pseudoscience, and here's one that's been cooked up based on a misunderstanding of technology. Here's the myth. You need to microwave your mail to kill the COVID-19 virus. Now, some people are concerned their mail might be infected with the coronavirus, but there are currently no cases of anybody getting the virus from their mail. There are various estimates about how long the virus can survive on various surfaces and on paper. Some research says it'll survive on paper just a couple of minutes, others say up to 5 days. But you have to realize, before your mail ever reaches your home, it goes through several days of delivery, including machine processing. Now, before you go tossing your mail in the microwave, you need to understand how microwave ovens work. They use electromagnetic radiation to heat food, and they don't heat food evenly. Now, cooking something long enough and at a high enough temperature can kill pathogens like COVID-19, but mail is not food, and you can't cook it. Microwaves were built to heat food and beverages, and there are some things like paper which should never be microwaved because of the danger of fire. Additionally, there are no set standards for using a microwave to disinfect any kind of object. So let's just stamp out the myth that your microwave oven can disinfect your mail. Working for you, I'm consumer investigator Steve Sprazier. Unfounded medical advice floods the internet, especially when it comes to the coronavirus. And here's one bit of advice that sounds especially scientific, at least at first glance. Here's the myth. High doses of vitamin C effectively treat COVID-19. This claim about vitamin C has been shared and reposted all over Facebook as people seek a cure for the coronavirus. Oranges and orange juice are known sources of vitamin C, and there are tons of supplements like this which claim they'll boost your immune system. Although vitamin C has been shown in a few clinical trials to sometimes reduce the severity of colds or flu, there is no scientific research supporting the claim that mega doses of vitamin C will lessen the severity of COVID-19, much less cure the virus. By mega doses of vitamin C, we're talking doses exceeding a daily level of 2,000 milligrams, because that can cause nausea, diarrhea, and abdominal pain. Now, your body does need vitamin C, and in normal doses, it acts as an antioxidant. But if you're expecting vitamin C from oranges to squeeze out the coronavirus from your body, guess what? That's just pulp fiction. Working for you, I'm consumer investigator Steve Sprazier.